Hello, doctors. Dr. Bo Rochester here again with you to go over another feature in the posture raise system called the view box. And we're going to go ahead and select view box here. We're going to call up a patient by name here. And of course, I have all the names hidden to comply with HIPAA. But this is a test patient, and we're going to use them to demonstrate the view box here. Alright, let's go ahead and use this patient right here for demonstration purposes, and we're going to go ahead and hit. Now there's some features right here. You can go 2 panes or 1 pane. You can also change the colors from white to red, to yellow, to green, whatever colors you like. You can put black on there if you like. I like white most of the time. That shows up nicely, but sometimes if the skull is too white, it won't show up well, and you can change it to green or red. I'm going to leave it on white. We're going to do 2 panes right here. I have it selected so that we can compare it to normals as well. So we're going to look at this right here, and we can see that this patient has the analysis done. And what I like about this is you have overlays here that shows things like the overall lordosis compared to what would be a normal x-ray here. This particular case has about a 53% decrease. We have a little bit of an anterior head translation situation of about 26 millimeters. These can be turned on and turned off. We can see that it's identified an area of what appears to be a break in George's line. It highlights it with a red line. Those types of things. We can advance this to the next view here, which is the vertex analysis, and we can see again we compare it to a normal, and we can use this to show 2 patients, or we can use it during our adjusting procedures. And if we needed to, we can draw lines on it to point to things, or we can tell a patient what we're going to do, or if we're going to draw an adjusting vector, something like that. Has some nice features there. We can compare it to normal as well directly on this by clicking this one button, and we can turn off the overlay again, on and off there, and that's a very nice feature. We can go to the nasium here, and we can see that this particular case is the end of the kink type, or what we call a type 3. It has a inferior spinous in orthospinology. We see it has a left head tilt of about 2.5 degrees. We're going to use a height factor of about 3.25 degrees, an instrument setting of about 12 degrees in this particular case. A little bit of a low plane line. It gives you all the features you need to set this patient up. And also a patient can see, compared to what a normal listing would be, you can also turn a normal on right here. And for doctors that you want to look at the head tilt, it's very obvious this is a left head tilt. We've got the left displayed on a reading left for the display purposes. And we've got a left head tilt here. A lot of doctors want to see this very quickly as they're adjusting, moving through their day. And again, you can turn this on and off. And we're back to the lateral, and I hope you enjoyed this presentation.